recording now. Okay, so you guys told me a little bit about yourselves and how you heard about the program, and I'm going to tell you a bit more about our program itself. We are one of the only interdisciplinary programs in at the University of Georgia State University, and you'll see from our first slide here that we're a collaboration between where I'm housed at, which is the Birdie F. Lewis School of Nursing and Health Professions, and then also the J. Mac Robinson College of Business. So you guys have a really diverse background, which I really like because most of my students from my current cohorts were coming from nursing. We had a lot of students that were nursing students, but now you guys are coming with a lot of different backgrounds. So that's really nice. I like that. It helps us to have a much more diverse population within our students, which is great to have. So I'm going to tell you some about the program. I could tell you a little bit about myself first. I am a registered dietitian by trade. I actually went to school at Georgia State and went to grad school for nutrition, got my graduate degree there, and I taught part-time since 2007, and in 2011 I came back to Georgia State to do admissions and recruitment for our health professions, so not nursing, they're in our college, but a different part of it. I did physical therapy, respiratory therapy, and nutrition, and then I taught for nutrition. And then about a year ago, or probably about 2 years ago, I started helping with starting this program. And then I was promoted and formally became the program director of health informatics. And so I am the person who advises many of our students, leads our admissions, our faculty, works with the community in setting up practicum sites, which is the internships, which we'll talk about later on in this presentation, and things like that. We do have other faculty members. They are either with the business school or they're with our college, and I'll tell you more about them when I get to that portion. But that's a little bit about me. I've always been interested in technology, so this was a really good fit for me. I use it in practice, and I still use it in practice as a dietitian, so this is something that is of interest to me. And I'm also currently in school for informatics. I'm just doing it through Duke University as a post-bac certificate in in health informatics. So I'm also a student of informatics at the moment. So I don't know how much you guys know about informatics. Hopefully it's something that you've looked into and you have, coming up on my screen, I'm not sure what that is. So you may have heard of the term of informatics. Had any of you heard about it before you had talked to Angela, the advisor, or happened to stumble upon it as you searched over the Georgia State website? Okay, you had. Okay. I'm going to try to say your name, Kiberton. I'm probably saying that incorrectly, and I apologize. But can you take a moment to kind of type out where you had heard about the term informatics before? Or anyone else who wants to kind of join in if you'd heard about health informatics? Or you can chat, or you can talk if you have your audio enabled and your mic. Okay. Okay, so you heard about it at work. Okay. Do you work in a hospital or a clinical setting or something like that? I like how you said it's thrown around at your job. It's thrown around a lot in healthcare organizations nowadays. Okay, work study position at CDC. Okay, so good. So yeah, so health informatics, you're in the community, you'll hear a lot. Crystal, you said you work as an LPN, and there's a lot of conversation because of health informatics because of electronic medical records. Good, yes. So if you are in the healthcare organizations like Crystal is, or CDC, then you will have heard the term informatics. And this Venn diagram that we have on here kind of gives you an idea of what informatics is, using information science and computer science in the industry of healthcare. And we've used information science and computer science in many other industries. Healthcare is actually one of the last ones to kind of adopt it. And so there's been a big push. There was a law that was signed in 2009 by President Obama, and that put money into education, of educating the workforce so that we could have people who would be able to assist with the adoption of what are now called electronic health records. The EMR that Crystal is speaking of is part of an electronic health record, but now we have other components to electronic health records, like, for instance, being able to view MRIs, or patients being able to use, like, I have a jawbone done, so if you have a technology like this, a wearable, now can that integrate with the electronic health record system. So, and I'm just saying, just a really tiny, small piece of it. So I always urge the students who are applying to this program to go out there and do some own research about the term informatics and what it is, so that you can kind of get an idea of what direction you want to go into. We educate our students so that they can go into many different areas, and we do prepare them if they want to go off to graduate level clinical programs. So for instance, if you were planning to become a nurse, one of you guys mentioned that, I think Crystal, it was you, that you might want to do nursing first and then maybe do informatics later on. Your other option you can do is to do an undergraduate degree in informatics, this program, and then you could go off and do a graduate level nursing program, a nutrition program, physical therapy, respiratory therapy, or occupational therapy, or you could go off and become a physician's assistant. There's many different graduate level programs. So if you're interested in that, let me know kind of offline, and we can talk about that so that you can plan that out, because I try to, for my students who want to do that, incorporate in the prerequisites that you need for those programs while you're in undergrad, so that you don't delay that too much longer. But health informatics is using those disciplines and technology to design, develop, and adapt IT-based services for healthcare. So when most people think about informatics, like Crystal said, they think about EMRs or EHRs, and that is true. That's just, though, now one component of the field of informatics, which I think is great for you if you are interested in that. So why should you choose a major in health informatics? Students want to know, what do we look for in an application? And I will tell you something that is the kiss of death if you write in your application that I wanted to be a nurse, but I couldn't be a nurse, so I decided to come into this program. This is not a nursing program. The folks who are in my program and my students really, really like technology. They are problem solvers. They like working on a team. They're comfortable in a rapidly changing environment. They are really comfortable with becoming a lifelong learner. And I'll give you an example. We have a curriculum, if you visited our website, that is currently up there for if you either start in the fall, if you start in the spring. I had a faculty meeting with my faculty on Monday, and we had a conversation about our curriculum. And we have the challenge, I think it's exciting, but it's still a challenge in our program, that we literally are trying to train students for jobs that we don't know that exist yet. Because you come out from school 2 years from starting the program, this field is changing so quickly, we don't know what's going to be on the horizon and what you will be applying for and what kind of jobs you'll get 2 years from now. My current students, 2 years ago when they started, I had my first 2 cohorts graduating at the end of May, or the beginning of May, and we did not have in the curriculum data analytics. And we just heard last fall, that's kind of the jobs that they'll be going into, is analytics and intelligence. So you have to be willing to be a lifelong learner, because as much as we'll try to capture within the curriculum, there will be times that we'll come to you as your faculty and say, hey, this is what seems to be coming up on the horizon, or it will be on you to really choose and say, let me make sure I pay attention to what's going on in the world of informatics so that I'm prepared to go into the jobs that I want to get. But the shift towards using electronic medical records and electronic health records is definitely increasing the need for informaticians and other technologies that are being put into healthcare that we haven't seen before. So these are just some career opportunities that you may have. People often ask me when they start the program, what kind of job am I going to do? Like I said, I don't know, because this is such a changing field. But some of the ones that are more emerging, especially in the second column over here, so starting at this business and clinical intelligence, is a large area that we're seeing now for our students that they'll be going into. Data analysts and business analysts, HIE or Health Information Exchange professionals, subject matter experts, security and privacy. You've heard about breaches in security and privacy in all sorts of industries, but it's becoming very important, and they're hiring folks in those areas. So if you go out there and you want to do a job search and you type in the term informatics, you're going to miss a lot of the jobs that you would actually be trained and skilled for. So this is definitely not an exhaustive list, This is just some ideas of what kind of jobs you would have. If you go on to become a clinician, you're going to be more marketable because clinicians know the clinical environment, and that's very key. But you don't have to be a clinician to be able to work in informatics. And I think one of the strengths of our program is our faculty. Our faculty is made up of folks like myself who are clinicians, but then I also have people who are non-clinicians who are working in the informatics arena, and they are engineers, or they have maybe a cloud-based server background or something like that, but they have been able to integrate themselves into the healthcare environment. Meredith had a question of, can you give me a brief description of what an HIE professional is? So there's a big push with the whole point of electronic health records for organizations was that if you, say we're here in Atlanta and this is where you lived and you went on vacation to Sierra Nevada, let's say, and you're skiing out there and you break your leg and you go to the emergency room out in California and they want to be able to access your medical records. There's no way of doing that unless the hospital you go to for care has your medical records and they can access them from your doctor here in Atlanta. Because let's say you have, you're on a blood thinner and they need to know that before they give you surgery. That's really good, and you're unconscious. That's not good, but that's what could happen. People who work in health information exchange are working on creating databases that talk to each other so that all these different electronic health record systems, no matter who the vendor is, they will all talk to each other. And so that's kind of the next push. So a lot of different larger healthcare organizations have adopted a vendor. So they have Epic or Cerner, Meditech, McKesson, Athena Health, all these different electronic health record vendors that they're using. But those vendors don't necessarily talk to each other. And so there's a lot of jobs out there for people who are working on how do we get all these different systems to talk to each other. I hope that answered your question, just to kind of illustrate what that professional looks like. So very interesting work that's going on in that area, and that's a good question to have. And who are your future employers? Many informaticians obviously work in hospital systems, but they also work for the vendors I just spoke about. They may work in physicians' offices and clinics. Department of Defense, for instance, and the VA have put out an RFP, basically, a request for proposal, and billions of dollars are now being put out to update their electronic health record system. So there's a lot of different areas that you can go into. Somebody mentioned the CDC, so public health has a large interest in electronic health records and informatics, so you'll see that as well. You said a question of what would you do if you're a consultant? Many different things. That's just kind of a blanket term of somebody who comes in to service an organization when they don't have the talent there. So they may need somebody to help to implement an electronic health record system. They may need people to train their employees, their clinicians, on how to use an electronic health record system. They may want to revamp their electronic health record system. They may want to add on more technologies to the EHR. So you could be a consultant doing all those things. You could be a project manager. You could be in sales. You could be in training. Those tend to be the project management, sales, training tend to be the roles of a consultant. And then also the ones who are coming in and basically helping an organization to do a needs analysis to see what electronic health record system would be the best for them. Or when a lot of companies, healthcare systems, or ambulatory centers, which are just outpatient centers, adopt an electronic health record system, they will hire consultants to come in for what's called a go live, and that's when you're going live. You're turning the system on. It's happening, and we're going to go electronic. So they'll bring consultants in to kind of help for a short period of time. So there's many people who work as consultants. Exactly, it's a contractor position. You can become a consultant for the big consulting firms like Deloitte and Booz and PricewaterhouseCoopers. They all hire, Northrop Grumman, all those guys hire consultants in informatics. So you could work for a company if you don't want to be an entrepreneur, which is what a contractor is. But you can also be an entrepreneur and be a contractor and kind of come in and out and on your own. So there's many different options that you can do. That's a good question. So one great thing about being in Atlanta is we have a lot of health IT companies here. I don't know if you guys have heard of Athena Health, but they are one of the largest cloud-based electronic health records company, and they just relocated to, or they just based themselves here in Atlanta. They're over in Ponce City Market, which is across from that Whole Foods on Ponce. We also have McKesson here, which is a big company. We've got Greenway, which is a big company. Allscripts, there's a lot of different folks, but you can see on this map, and when I send out this link or this PowerPoint, you can click on this. So my students, when they ask, one, where can I do my internship at, or two, where can I get a job, I ask them to look at the map. That's a lot of companies that you can choose from. They all work in different spaces in informatics. There's a lot of technology jobs here in Georgia. If you'd like to leave Georgia, of course, there's technology jobs, healthcare technology jobs in all these different, especially major cities. But then there's also a push to bring technology to rural areas, so you could actually make quite a good living if you're willing to go out to rural areas. You may have to travel a bit, but you could do that if you want to do that as well. So this is just a good map to have as you're looking at those sorts of things. So students love this, this earning potential, so that they could see how much they could possibly be earning. I do tell them to direct their eyes to the lowest 10% when you first graduate, because you are entry level. If you're a clinician, you're going to expect to be more in the 77,000 to 84,000 range. So I'm sure you guys like these numbers. They're very realistic. This is not a top 10% of students possibly. If you get into health IT, you can expect to be making this type of money. It just is what it is. If you're a clinician, like I said, you're going to get higher. If you work for yourself, you probably have a higher earning potential. And also with this degree, you don't have to get a graduate degree. So you're saving money on that end because you're not paying for grad school right away. A lot of you will see the benefit of going to graduate school for one reason or another, but you do have the benefit that you can go out and find a job fairly easily in an area of informatics, and then maybe save up money to go back to grad school, or get your company to pay for you to go back to grad school if you would like to do that. And I think you've gotten the sense that the job outlook is really, really good in this area. Like I said, in 2009, that federal law was signed, and so there's going to be new jobs coming out. But as we're seeing more issues with security and privacy, more patients are now starting to access their electronic health records. There's just a lot of different technologies that are coming in, and different mandates such as meaningful use. You may hear standards terms like HL7 and things like that I know are probably Greek to you right now, but I just say all that to say there's a lot of work that still needs to be done. Just because most of the major healthcare organizations have adopted an electronic health record, that does not mean by any means that the work has been done in informatics. There's a lot of potential out there. I currently have placed my seniors in their practicum, and they're at different organizations like Wellstar, Emory, Piedmont. They're at companies, data analytics companies. They're all over the place around Atlanta. And almost all those places have said to me, if the student does well in this position as an intern, they're going to have a job here. Every single place has said it. It's pretty amazing, and the students know that going in, that they're probably basically doing on-the-job training if that's where they'd like to be. So it's a very good field to go into as far as your job, potentials of getting a job. And so is this career right for you? I like this picture because it's showing, you know, a doctor or some sort of clinician with a tablet, and they're using it in practice. Sometimes students will tell me, and this is great, all of you guys signed on here really well, and that's telling because you have to like technology. You're the expert in technology for your organization. You also have to be analytical, enjoy problem solving, so enjoying being given a challenge that there's no one out there to tell you how to do it and to figure it out. And you do have to like people. This is not the type of IT career where you're down in the basement coding somewhere. Those folks do have a space. It's called computer information systems or computer science. And we do have programs in that at Georgia State. But you are definitely working with people a lot. So if you feel like, oh, you know, I wanted to be a nurse, or I wanted to be a clinician because I enjoy helping people, you will still have that same sense from working in informatics. But also you do have to have that love of technology and be willing to try out new technologies because that is what your role will be. So I want to tell you a little bit more about our program here at Georgia State. This is some of our students actually that we have currently in our programs. A couple of them are PT and and nutrition students, but 3 of these are my students currently who are all about to graduate, my first couple cohorts. So we are a cohorted program. So let me tell you a little bit about our program structure and how it's formatted, because that's the most important thing I think to you right now. So we are application only, so we do a ranking of our applicants. We are looking at your overall GPA, but then we also look very, very closely at that prerequisite GPA. So not the program GPA, which is those areas A through F that your advisor may have told you about, but we really look closely at those prerequisites, which I'll show you in a later slide. Then we also look really closely at your essay. And the reason why is because this is a new field, for education at least, and we want to make sure that the students who are coming in know what they're getting into, and they know a little bit about health informatics. So I urge you really to do your research, even if you want to chat with myself or you want to go and talk to someone else who works in informatics, which would be great. We want to see in there that you're saying terms that tell us that that student or that applicant knows what the field of informatics is about. They're not just saying, oh, I heard about this from a friend, or I wasn't able to get into nursing school, so this is what I'm trying out. That's not what we're looking for in our applicants. And I'm really glad to see that you guys have such a diverse background. Makes me very excited. So let me tell you a bit more about our program. And like I said, if you have any questions now that are related to the program, feel free to just put them in there in the chat box, and I'll try to get them. This is also another picture of some of our students at a health IT conference that we were at earlier in the fall. But our distinction of our program at Georgia State, we are the only truly interdisciplinary health informatics program in the United States as of today. That could always change. What that means is that even though I work in the nursing and health professions department or college, and my colleagues work over in the business school, that's what makes you interdisciplinary. So instead of us over in who are clinicians trying to teach you computer information systems, we have the computer information systems faculty actually teaching that to you. So they're computer science folks. And then we have the health administration faculty teaching you the health administration components. And then, like I said, we have both clinicians who are informaticians and informaticians who are not clinicians who are part of our faculty, but we all come together to form this whole program that you'll have together. So you do have faculty who have both research experience and practice expertise. I think the practice expertise for a bachelor's program is extremely important because they know what's going on in the organizations. For instance, I have faculty members who work for Cisco Systems, who own their own consulting companies that work with Medicare and Medicaid beneficiaries. They work at Emory in Informatics, they work at Children's in Informatics, they're enterprise architects, they're subject matter experts, we have attorneys, we have all these different folks who are teaching their area of expertise. So you're going to get people who are not just academics, even myself still practicing, you're getting people who are actually have practice knowledge. Meredith's question was, one of the prerequisite classes is advanced medical terminology. So does that class focus on terms that pertain to informatics? Or it's medical terminology for all healthcare. It's a general medical term class that all of our clinical students take. So it will cover all those different areas. We have a diverse student population, not only through like ethnicity, but also like you guys mentioned, that you guys are coming from all different backgrounds. We definitely have a lot of people who are second career or halfway second career who thought they were going one area and now they are maybe in their 3rd or 4th year of college and they still need to figure out what they're doing. So I do have students like that. So they're a very, very diverse student population. And then one thing that kind of sets us apart from other informatics programs, especially in the Atlanta area, is that we offer at the undergraduate level a practicum or a simulation. So what that means is that I was going out to the Wellstars and the Piedmonts and Grady and all those guys in Atlanta and saying, we're training these students, but they are not clinicians, and we know that you guys really like clinicians to be your informaticians. But if they're not, what do you want them to have? And they said, we want them to have hands-on experience. They need to have some real experience. That serves 2 different purposes. One, it serves a purpose that they're going to have some experience working in the field, but then 2, if you're a traditional college-age student and you've never worked in a business environment, and this, you guys, is a very business-oriented field, it's not clinical. So if you're thinking how nurses work, this is not that type of field. It's very, very business-oriented. they wanted students to have that those experiences. So we're working really hard to set up practicum experiences. I mentioned those before. But then we're also utilizing our simulation lab that we have on campus. We have two. One is a hospital. It looks like two different hospital rooms with patients in there. They're mannequins, but they're patients. And then we also have a simulated apartment that our students can use. And we're creating simulations so that we're preparing our students not only before they go out to practicum, but if we run into the situation where we don't have enough sites to place students in practicum, they can still get a similar experience through our simulations. And then also we offer our program at not only our downtown campus, but we have a Buckhead Center, Peachtree Dunwoody Center, and Alpharetta. So currently right now, with my undergraduate students, they're only going to Peachtree Dunwoody, which is, if you're familiar with Northside Hospital area, St. Joe's, and the King and Queen building, it's right across the street in Peachtree Dunwoody from the King and Queen building in a building called the Palisades. And those facilities are really state-of-the-art. We have a lot of great technology in there. And the reason why I mention it is because we will be taking 50 students in the fall. And that's a big class for Georgia State. And downtown, there's not a lot of real estate for classes, and it's just very tight. And so many of our courses that we offer are either hybrid, online, or we offer them at Peachtree Dunwoody. So I do tell students that if you do have classes at Peachtree Dunwoody, when I schedule the classes each semester, I will never have you taking a class downtown and then having to travel up to Peachtree Dunwoody. We won't do that. If you're taking classes at Peachtree Dunwoody, you're either taking 2 classes that day, and you can plan your day there, or you're taking 1 class. But you'll never have to go back and forth. And then we also do work really hard. It's not a guarantee, but we try every semester to either have the schedule 2 days and 1 night, or 2 nights and 1 day, so that our students can work. That is a little bit different for your last semester where you're in your practicum, but we do try to work with you on that. Because it's a cohort program, you are in a lockstep program, which means that once you come in with your cohort, you take all your classes together. And the schedule that we give you is the schedule that you have to take. The reason why is because we open this program up for students to start every fall and every spring, we have to make it a bit more controlled. If we make it more so that we could have more offerings, we wouldn't be able to take people every fall and every spring, and I think that the benefit of having those different entry points is extremely important for our students because if not, you've been in this situation before, we have to wait a whole another year before you can start school, which is a long time. So we try to make that happen for our students. So here are the prerequisites for the program. Because we are cohorted, you do have to have all these prerequisites done before you start. So let's say, for instance, you want to apply for fall of 2015. You have to have Anatomy 1 and 2, the CIS 2010, the SNHP 2010, SNHP 2000, all completed by this summer. So we need to have all those courses done this summer. If not, then you can start and apply for the next spring of 2016. But you do have to have, you can't have any outstanding prereqs. You also cannot have any outstanding core courses. So your English classes, that American history Georgia State or State of Georgia has you take, all those kind of core classes that you have to take in your first 2 years of school also must be completed before you start the program. That last part down here, any 3-hour, 1,000 or 2,000 level elective, basically what Angela Corley does, who is the advisor who works with me with students, some of you may have talked to her, she basically goes through your application and finds an A that you got in a 1,000 or 2,000 level course and adds that into your prerequisites. So that's not something you have to worry about. But I just want to make it clear that you do have to have all of your prerequisites completed before you start the program. That does mean that obviously the application deadline may come and you may have some classes over the summer. What you would indicate on the application is that you're planning to take, let's say, for instance, CIS 2010 over the summer, and you'll get a conditional acceptance, it's called. Basically, we're saying you're accepted to the program as long as you successfully pass that course, and then you can start the program. If you do not successfully pass the course, then you're not eligible to start the program. So if you guys have any questions on that. Judy asked, do we recommend any 3-hour elective to take? This is just me. I suggest if you haven't taken it, a lot of you guys have, public speaking, because you'll use it a lot in this field. And I teach training and instructional design within our curriculum, and my students probably hate me this semester, but I'm making them speak a lot in front of a lot of people. And it's because you're going to work with doctors who are surgeons and business people who really expect you to really speak very well. And that's just one area that students often struggle with. And it's just a practice makes better type situation. So that's one thing I would suggest taking. If not, and you weren't planning on taking an extra 3-hour elective, we'll get you a lot of public speaking in while you're there. We'll get a lot of writing skills also in, because that's something that's also important. So that's something you need to have as well. Meredith said, is statistics a prereq class? I think it's an area A through E or G, D, or something like that. I think it's a Georgia State prereq, but it's not a prereq for our program. And the reason why you may have seen it as a prereq for our program in the past is that we initially had it in there, and then we realized that Georgia State already required it, so we took it out as a prereq to add in some of these other prereqs, or one of the other prereqs we wanted to add in. Any other questions about the prerequisites? And the SNHP 2000 course it was required, correct, it was not required last semester. It is a new prereq. And I've realized it's not listed on, I don't think it's listed on Go Solar. I just discovered this past week. So we're working on getting that listed. It will be offered on Thursday evenings, I believe. And it's an online course. You can only take it at Georgia State. I will let you know the person who teaches the course sits in our admissions committee. So she is someone that you really want to impress while you're taking the class. She teaches your electronic health records course in the first semester. So you just take that course at Georgia State. And you're right, it was not something that was offered before. If you can't take it over the summer and you didn't take it this semester, you'll notice in the small print there that you can take that as a co-requisite through the first semester. I'm sorry, you can take it as a co-requisite in your first semester of the program through the cohorts that start in the spring 2016. So let me explain that to you. If you don't take SNHP 2000 this summer and you're accepted to the program, because it's a new prereq, you can take it your first semester of the program. So in the fall, if you're accepted, this fall coming up, you can take it then. If you're not able to start this fall and you can only start in the spring of 2016, you can also take it then. If you start anything after that, you start in the fall of 2016, you will have had to have taken it as a prerequisite. I hope that makes sense. Judy says, Kim, 1151 needed? Not necessarily. You just have to have a science series, and Angela would be the one to actually help you on that, to let you know if you have a science series. If you took 1151, then your science series could be taking Kim 1152. But there's some other options as well, like biology series and things like that. So yeah, Judy, just ask Angela, talk to her. And I did not put her contact info in these slides, but when I send out this slide deck, I'll put her contact info in there so you guys can reach out to her. I would encourage you to schedule an appointment with her. If you have questions about like the prereqs like you guys have right now, talk to Angela. If you want to talk about the field of informatics and the actual program, I would be the person to talk to, but she's the expert on that. If you have any transfer credits from other institutions, she would be the person to let you know about those. That's her area of expertise. So Crystal said, do biology 1110, 1120 credits expire and need to be retaken? No, not for us. No, they do not expire. Any other questions about the prereq? Okay. If you have any, we have a couple more slides, I think, to go. How long is the program? It is 5 semesters, roughly 2 years. So if you start in the fall, you will finish the next couple of springs from there, 2 springs from then. If you start in the spring, you will complete the next 2 summers. And you will be in school for at least 1 summer. So if you start in a fall cohort, you will have 1 summer. If you start in a spring cohort, you'll have 2 summers. So just keep that in mind. We do try to work with students over the summer so that if we give you a Maymester course, it's online, that you guys can travel and have a little bit of a break. Summer courses tend to be on campus, so at least hybrid, so you're not able to like completely like go abroad or something. I do have students who are doing semesters abroad over a Maymester, and that's fine too, so you can do that, and I'll work with you on that. So just, you know, your advisors will work with you, your faculty advisors, with that, but it is a 2-year program. And it's 5 classes on many of the semesters, so it is a rigorous program. So just keep that in mind because you are required to take all those classes. We do not have a part-time option at this point for the program. And there'll be 50 spots, like I said, available every fall and every spring. Does anybody have any other questions about, I think that's my last slide. No, it's not. Okay, sorry. Deadline is May the 15th for fall of 2015. It's October the 15th if you need to apply next spring. So if you're one of those folks who's planning ahead. Any other questions? Okay. Well, thank you all for attending. I hope you enjoy the little break that we have. Oh, there's a question. What if we want to apply for the fall semester, but we take summer classes? So you will indicate on the application duty that you're in progress of some courses, and we'll be able to look those up or whatever. And then what we'll do is give you what's called a conditional acceptance, and basically it's saying you're accepted to the program as long as you successfully complete the remaining prerequisites, either the core prerequisites, your core education requirements like English 2 or whatever, or our prerequisites for the program. You have to finish those with a satisfactory grade, do the C or better, and then you're fully accepted into the program. So at the end of every summer, for both cohorts, but for the fall cohorts, what I do is I go back, especially if you took the classes at Georgia State, and I pull your transcripts. If you took a class at like Georgia Perimeter or something else, you would be required to send us an official transcript in so that we can verify that grade. Good question. Okay, and said, what will our degree title be? It will be a BIS, Bachelor in Interdisciplinary Studies in Health Informatics. So we had that term clinical informatics out there, and you may have noticed if you went on the business school website, they also have some programs that have a concentration in health informatics. So they have a computer information systems degree with a concentration in health informatics, and then the graduate level health administration, master's in health administration program has a concentration in health informatics, but neither one of them are giving you a degree in health informatics. Our program's the only one that does that. So that's why we dropped the clinical part of it, because we wanted to make sure that the students knew and that your future employers knew that you were getting a broader education in all of health informatics. And because of that, you're getting telehealth courses, and we're adding a data analytics course that our students will have. You're getting a much broader education, so that has you prepared for many other things. But your degree would be BIS in health informatics. I'm available by appointment. I don't hold office hours, so I will just shoot me an email and just let me know when you're free, and I'll figure out if that matches up when I'm free. And if not, we'll figure it out. And we'll just do it from that way. But yeah, I don't have any actual office hours. Meredith said, will the classes that we take to complete our degree prepare us to sit for the RHIA? No, we are not accredited for the RHIA program. That's a good question, Meredith. The way that it's kind of working right now, so the RHIA folks came from the world of people who were doing a lot of billing and coding. So if you look at the curricula of programs that do prepare you to become a registered health information administrator, they're very billing and coding focused. They don't have as much informatics education as we have in our curriculum. So they're more of a technical kind of, I don't want to say a trade, but more of a 2-year school program. Our students are going to be people who are in management roles, who are leading teams, designing and engineering, architectural kind of a role, so a higher level role in RHIA. And so the certification that we're preparing our students to take is what's called the Certified Associate in Health Information Management Systems. And I'll send you this when I send all the other information. But that is called a CAHIMSS, and it's through the Health Information Management Systems Society, which is kind of the informatics organization, professional organization out there, and it prepares you for that exam. We don't require the exam, but it prepares you for it. I hope that answered your question, Meredith. But we're not training billing and coders, biller and coding people, if that makes sense. So we have a different level of education that we're doing. And I'll send the CPHIMS, or CAHIMS, sorry, information. One of you guys, Crystal or somebody who's an LPN, if you're working in a clinical environment right now, there's a higher level of that, or more professional level, I should say, of that certification called the Certified Professional in Health Information Systems, Management Systems, and the reason why that is a higher level is that you have been practicing in a clinical setting for at least 5 years. So if any of you have, you can take the CPHIMS exam. Similar to the CAHIMS, it's just you have more experience. So I'll send you that information. Alyssa said, once we receive our degree, are we able to teach health informatics? Do you want to teach it at a university level like Georgia State, or teach it within a healthcare organization? Georgia State, so if you want to teach at Georgia State, you have to have at least a master's degree at universities. But you could probably teach it at a 2-year school, a community college. But in order to teach at Georgia State, you have to have at least your master's degree. They prefer a doctorate, but we do have a lot of master's folks who are teaching our classes, our master's degree. So you would have to have at least that. You would definitely be prepared to teach it, though, in a healthcare setting. We'd be able to do that. Crystal said, what kind of computer science skills? So you're not going to be learning that much programming. We will let you know about, you're going to learn about how to build databases. Like I said, we're adding on a data analytics course, so you will get training in data analytics and enterprise intelligence or clinical intelligence. You can kind of Google those terms to see what those are. But the programmers are a different skill set, and so we are training our students to be the liaison between kind of those programming folks and the clinicians. So we don't focus on training in programming, but it would definitely be helpful for you if you wanted it. And if you did, you can often take, if you've heard of the MOOCs, the massive open online courses offered through like edX or Coursera, and they will have free computer programming languages. So if you want to, whatever programming language you want to do, you can take them there, and that can kind of supplement our program if that's the area you like to go into. Or you could take an elective, a programming course, maybe in CIS, if you wanted to do that. If you're more interested in really programming and being kind of like a coder, honestly, the Computer Information Systems program in with a concentration in health informatics would probably be a better fit for you, because that's just not where our students are at. They're definitely more hands-on, working with people and the technology and how people use technology. I hope that answered your question. Meredith said, are there continuing education credits that we need to obtain periodically? In order to keep that CAHIMS or the CPHIMS, you will have to do continuing ed. So it's similar to the other disciplines like myself as a dietitian, where I have continuing ed, or nurses. So there is some continuing ed for that. And you said earlier, you mentioned PA school. Will degree in health informatics be sufficient foundation before applying? Probably not. You probably have to do some more prerequisites before PA school. Good question. Same thing if you went into physical therapy. We will soon have an occupational therapy program at Georgia State, nutrition, and respiratory therapy. All those programs in nursing, you would have to do additional prerequisites specific to their program. So PA school, we don't have a PA program at Georgia State, but I imagine that they're the same way. There's some more prereqs you'd have to do to apply to those programs. But that's a good question. And the sooner you know that you want to go to grad school for those, the better, because then maybe we can, I always like to work with my students and kind of weave in those prereqs if we can. So let's say your first fall semester, all day Thursday, you're open, and there's a physics class that you need to take because you want to apply to PT school later on to be a physical therapist. I'll say, let's go ahead and add that into your schedule so that you can have it done, and you're not in school for extra time. That's really good for you guys who are getting like HOPE and those other financial aid, because they're paying for you to get the prereqs, and if you graduate and get your degree, that financial aid stops. So we try to get the most bang for your buck. I just need to know enough in advance to be able to help you with that. but I do try to help my students with that. Great questions, you guys. Are there any public health courses that we could take periodically throughout the course? So we have a public health IT course. If you look at our curriculum right now, it's called Health Promotion and EHR, but it's really Public Health IT. We're actually going to change the title of it. So we have that. And then we also have, many of my students are interested in public health. And so we are setting up practicums for them to go to. I have 3 students right now that are with the Public Health Informatics Institute, if you've ever heard about them. And we're working on setting up relationships with the CDC. But that's as far right now as our public health goes. And then I have many of my graduating seniors who are going off to school for an MPH, a Master in Public Health. I have about 5 or 6 of my seniors who I'm writing letters of recommendation for now. So they're applying to different public health graduate level programs. So that is another option. So we do a little bit of the public health IT because it's a big deal in informatics. And then you could also let me know when it gets to practicum time, hey, I would like to do my practicum in a public health setting, and we can try to arrange that for you. Any other questions? These are all very good questions. It makes me happy as I go along as a program director because I've been doing these info sessions now for almost 3 years now, and your questions are getting a lot better. I'll just put it that way from the people in the past because I can tell you know more about informatics. And I think this is because people, there's just more word out there now on the street about informatics, and so that's great. If you have any other questions that come up or anything like that, I'm going to send you guys this email right now before I forget, and then I can go on and kind of enjoy my day off, as it were, thanks to the weather. But if you think of anything, if you want to meet with me, let's try to meet in the by March. And so I want to do that so that if there's anything that's kind of outstanding, either meet with Angela and or meet with me because we want to give you enough time to be able to get in anything that might be kind of loose that if you want to apply for the fall. So if you can do that, I'm traveling quite a bit in April, but I am here all through March, including spring break at Georgia State. So if you want to come back on campus to meet then, that's fine too. So thank you all for coming today. Enjoy your time off. Hopefully, I know you're all inside somewhere, so I appreciate you taking the effort to come here. I really do. And I look forward to talking to you soon and seeing your application. You're very welcome.